Radiation therapy is a safe and important treatment for breast cancer. People with left-sided breast cancer are often concerned about minimising the risk of radiation delivered to the heart. There are many ways to minimise this risk. Deep inspiration breath hold, or DIBH, is the most efficient, safest and simplest of these techniques. We currently use two different breathing methods, a snorkel or goggles.
Breast cancer radiotherapy has evolved quite dramatically over the last 3 decades or so. In the past, we didn't have the image guidance that we have now, with the ability to do a personalised plan on every patient with a CT scan so that we know exactly where that patient's heart and lungs are. We can then target the breast tissue and exclude those two important organs.
DIBH requires you to hold your breath during your CT scan and each daily treatment. You need to be able to hold your breath for a short period of up to 20 seconds, several times during each daily treatment. When you hold your breath, your chest is expanded and your heart is pushed down and away from your chest wall. This process helps minimise the dose to your lungs and heart during your daily treatments. Once your doctor has decided that you're suitable for DIBH, there are 3 steps in the process. Firstly, an education session where your radiation therapist will give you an overview of the DIBH technique and teach you how to hold your breath correctly.
You're scheduled to go in for what's called a CT planning scan, and this is where they take all of the measurements so that the measurements and the alignment is exact every single time.
If using the snorkel method, the scan is performed while you use a breathing mouthpiece, which will stop the flow of air when your lungs reach capacity. Alternatively, you may wear a pair of video goggles, which guide you through graphics about when to hold your breath. Both the snorkel and the goggles allow your radiation therapist to see your breathing pattern. You are in control at all times and able to monitor your breathing. Our team will practice the breathing technique with you at the CT planning scan to make sure you're comfortable before going ahead with the scan.
So with imaging, they're having you take the deep breaths, anywhere from 2 to 5 breaths of varying duration. And then they'll announce that the actual radiation is going to be delivered. And then it's all done. A session lasts about 15 minutes.
During treatment, you'll lie down on the machine and get into the same position you were in when you had your CT scan. You'll hold your breath a few times using either the snorkel or goggles to complete the positioning image and treatment. Your radiation therapist will step outside briefly while the scans are being taken, and they'll monitor you from a nearby room. They'll guide you over the intercom as you breathe, using the breath hold technique. You're in complete control at all times and can stop treatment at any time.
The benefit to the patients for this type of treatment is that there's less risk of late toxicities or late side effects. And by making sure the breast gets an even dose of radiotherapy, the cosmetic outcome for the breast is better. Most importantly, by excluding the heart from the radiation field, there's no risk of the patient getting cardiac disease in the future.
I would say if there's any possibility of learning how to do some controlled breathing or some meditation, that would be helpful, I think. Ask questions. If you're not sure about anything, ask. And let the radiation therapists and the nurses and the doctors know if you're experiencing any problems, any difficulties, any discomfort.
Most people are able to hold their breath using the DIBH technique. If you have any concerns, please discuss with your doctor and radiation therapists.